Welcome, everyone, and thank you for joining us for our webinar on how anchor institutions are adopting a social determinants of health lens in their community engagement efforts. My name is Sharmila Lawrence, and I am a consultant with Mingo Incorporated, and I also facilitate the Anchor Institutions Task Force's Health Professional Subgroup, which I will be telling you more about shortly. Next slide, please. Our agenda for today will begin with an introduction to the Anchor Institutions Task Force from Dr. David Morath, who is the founder and president of Mingo Incorporated. I will then provide a quick introduction to the Health Professional Subgroup and an overview about social determinants of health and why they are important. And then I will introduce our two presenters, Dr. Terry Lippman from the University of Pennsylvania School of Nursing, followed by Ms. Angela Mingo from Nationwide Children's Hospital, and they will share their approaches in addressing social determinants of health. And then we will open it up for some questions and answers. Before we get started, just a few reminders that all participants are muted, and if you have any technical difficulties, you can send a message via either the question or the chat box, and one of our staff members will assist you. And then after all the presentations are completed, we'll open it up for Q&A, and you can submit any questions you have for the presenters through that chat box as well. So I'm now going to turn it over to David to introduce the Anchor Institutions Task Force.
Thank you, Sharmila. I just want to say a little bit about the Anchor Institutions Task Force before we get deeper into our webinar today. First of all, thank you all so much for joining us. I want to say a little bit about the Anchor Institutions Task Force that was created now 10 years ago. So this is our 10th anniversary, which is very exciting for us. The task force is an action-oriented learning community which promotes the engagement of anchor institutions in community and economic development. And you should know that the Anchor Institutions Task Force does operate with a particular definition of anchor institutions. We define anchor institutions as enduring organizations that remain in their geographic places and play an integral role in their local communities and economies. So, of course, you can think about universities, you can think about hospitals, you can think about other types of entities that are geographically rooted in their communities. They don't tend to get up and go. Conditions around them, demographically, economically, can change, yet they remain. This is why we call them anchor institutions, because they remain. They are, in fact, sticky capital in their communities. The anchor institutions movement has very much been growing over the last 20 years or so. And we are really seeing a proliferation of ways in which anchor institutions are engaging in their local communities, developing their communities in various ways, working on crucial issues like education, economic development, and issues around health equity, as we're going to talk a little bit about on this webinar. It's important for us at the Anchor Institutions Task Force to take a particular view at the ways in which anchor institutions work in their communities. That's why we promote specifically equitable growth in communities. And we are particularly focused on how to expand opportunities for the most vulnerable population. So there is a point of view with the Anchor Institutions Task Force. As I mentioned, this is the 10th anniversary of the task force, and our 10th anniversary conference begins a month from today, actually. It will be held in New York City on October 24th and 25th. Maybe some of you who are listening will be with us at this conference. Our conferences are really an important way to address how anchor institutions can improve educational and economic opportunities and reduce inequities of various kinds through community partnerships. This upcoming conference is particularly important for us because of our 10th anniversary. And you should also know that many of the issues that we're going to discuss on the webinar today are going to be followed up at the conference as well. We always have a plenary session on health at the conference, and we will have a couple of other members of the Health Subgroup presenting at our annual conference as well. So for those who want to attend and be with us for that conference, you will hear us continuing this discussion. And as I mentioned, the task force has a point of view. We have a rationale for why we were created and our values and how we think about this kind of work. The task force is based on individual memberships. So as you saw on the last slide, we have over 900 members. This is an individually based membership organization. We bring together the people who are committed to a certain set of ideals, who are based at anchor institutions, as well as other types of entities. Many of the members of the task force are not only in universities and hospitals. We're talking about arts institutions. We're talking about philanthropy, community organizations of various types, people representing government, the private sector, all really with a common sense of what we'd like to see. We see ourselves as a values-driven movement organization, and we're focused on some particular ideas in terms of a commitment to collaboration and partnership, a commitment to equity and social justice, to democratic practice, and a commitment to place. And the last thing I'll say is that we have 3 active professional development subgroups in the task force. One is higher education presidents, another is economic development professionals, and another is health professionals. And it's from our health professionals subgroup, which you're hearing from today. And here's some basic contact information about the task force if you would like to learn more. So Sharmila, I will now pass it back to you.
Great, thank you, David. Next slide, please. Just wanted to give you a little bit of background about the health professional subgroup that David mentioned. The health professional subgroup, the purpose of it is to provide a forum for a range of professionals in health fields to share ideas and best practices about addressing health disparities in their localities and regions, as well as to discuss other contributions that health anchors can make to improve the overall well-being of their communities. And the idea is that peer learning and exchange can really enhance practice. And so you can see here a list of our current members. When the subgroup first began in 2016, the members found that they all shared an interest in focusing on health equity issues and that they were adopting a social determinants of health lens in the way that they approached their community engagement efforts. So in March of this year, we released a white paper highlighting how each of these institutions is addressing social determinants of health in their communities, and you can see the title of the paper listed there. The white paper is available for download from MARGA's website. It's under the AITF section on the website. And today we are featuring 2 of our subgroup members and their strategies, but this webinar will be the first in a series that will highlight the other members of the subgroup and their approaches as well. So, next slide, please. Turning to the topic of social determinants of health, many of you may be well versed with this topic, but in case this is a new term for some of you, I just want to provide a quick introduction. So social determinants of health are defined as the conditions in the environment in which people are born, live, learn, work, play, worship, and age that affect a range of health functioning and quality of life outcomes and risks. And there are generally 5 recognized overall determinants of health. These are genes and biology, health behaviors, social environments, physical environments, and health services. Next slide, please. And while research is still lacking on the precise contribution of each determinant to health outcomes, it's estimated that genes and biology and health behaviors account for only about 25% of health outcomes. Next slide. So the other 75% of health outcomes are determined by social determinants, which fall into 5 key areas. Economic stability, which includes things like employment, income, expenses, etc. Neighborhood and physical environment, such as housing, transportation, safety. Food, including hunger and access to healthy food options. Education, such as early childhood education, vocational education, higher ed. The social and community context, so things like social integration, discrimination, civic participation, and healthcare, which includes coverage, quality of care, provider cultural competency amongst other factors. So research demonstrates the association between various health conditions and social determinants, such as the link between asthma incidence and mortality and living in substandard housing, the higher prevalence of diabetes among food insecure households, and for patients with heart failure, a higher risk of hospital readmission is associated with low socioeconomic status and a lack of social support. So clearly, having access to resources that enhance the quality of life, such as employment, safe and affordable housing, access to healthy foods, etc. It influences health outcomes and reduces the risks of developing chronic diseases like obesity or hypertension and asthma, among others. So that's one of the reasons why it's important to address social determinants of health. When individuals are born into poverty and face barriers of access, we see health inequities that arise. And this creates systematic differences in the health outcomes of population groups. And research shows that these health disparities disproportionately affect racial and ethnic minorities. So given that a person's zip code may have a stronger influence on health outcomes than the care that they receive, makes it really imperative to address these disparities. Secondly, with the passage of the Affordable Care Act, there's been a focus on moving away from a traditional fee-for-service approach to healthcare, which pays providers based on the volume of services provided, to more of a value-based care approach, which emphasizes improving population health and quality of care and reducing costs. And this is known as the triple aim approach to healthcare. So given the contribution of social determinants to chronic health conditions, focusing only on acute care will not reduce the cost of care or improve outcomes or quality of care. So to achieve the triple aim, we have to focus on social determinants. All of the members in the subgroup have sought to address multiple social determinants, from things like housing, employment, and education to economic development, food, safe spaces. And some have also used the social determinants of health lens to transform curriculum and the way that health professionals are trained. And all of the members in the group recognize that healthcare problems require solutions that exist beyond the hospital and the provision of acute care, and that preparing practitioners to treat patients in a holistic way requires them to have a deep understanding of the social determinants of health and have experiences with community engagement. And so it's this recognition of the importance of social determinants of health that has really guided their efforts. So with that being said, I'm going to now introduce our presenters to share their strategies. Our first presenter today will be Dr. Terry Lippman. She is the Assistant Dean for Community Engagement, the Miriam Sterl Endowed Term Professor of Nutrition, and the Professor of Nursing of Children at the University of Pennsylvania School of Nursing. She is also a Professor of Pediatric Nursing at the Perelman School of Medicine and a Senior Fellow in the Center for Public Health Initiatives. Additionally, she is a nurse practitioner in the Division of Endocrinology and Diabetes at the Children's Hospital of Philadelphia. Throughout her career, Terry has been committed to partnering with the inner city community through community-based participatory research to develop strategies to address social determinants of health and disparities in diagnosis, treatment, and outcomes. As the Assistant Dean for Community Engagement, Terry is responsible for leading and coordinating the School of Nursing's strategic vision and agenda in community engagement and addressing social determinants. Terry received her BSN from Temple University and her MSN and PhD from the University of Pennsylvania, and her honors include the Lindback Award for Distinguished Teaching. She's a fellow in the American Academy of Nursing and the inaugural recipient of the Provost Netter Center Faculty Community Partnership Award. So I'll now turn it over to Terry.
Thank you very much, Sharmila and David. I really appreciate being invited to give this presentation. Incorporating social determinants of health throughout our nursing curriculum is incredibly important. It really is the basis now of our curriculum, and we believe that community engagement is essential, that social determinants of health cannot be learned or addressed without community engagement. And I will really talk about changing the culture of a school. This was not the culture 10 years ago, and the culture has changed, and I am pleased to talk to you about how we went about doing that. So the question that comes up frequently is, why do we need a community context in nursing? And we talk about how all patients are products of their community and that the community gives true insight into social determinants of health. It's necessary to engage in the community, to collaborate with the community, to understand social determinants of health. And the key piece here, and I'll talk about this a little bit more later, is the collaboration in developing goals and really critically, adequately providing care is necessary regardless of healthcare setting. So it's not just for those students who are planning to practice in the community, it's for all nurses to adequately practice regardless of setting. Again, the social determinants of health. So this framework was developed a number of years ago, several years ago, by the National Academy of Sciences, and it was really a guide, a framework for educating health professionals to address social determinants of health. And this is what guided our curriculum revision. So why is this important? And again, Sharmila went over a number of these things, but I do want to talk about the three major components of this framework: education, community, and organization. So based on this, we really looked to see what we needed to do as a faculty to move forward. And it was clear that in order to educate our students on addressing social determinants of health, faculty needed to be comfortable addressing social determinants of health. So we were funded by the Provost Center on Diversity for a conference, a three-part conference on addressing social determinants of health. And this was the first part of our conference. Actually, our dean, Antonia Villarreal, was one of the authors of the National Academy framework on social determinants of health. This was our second part in the series, and this included our community partnerships. And our third part was led by Dr. Joe Greer, who is one of the members of our health professions group in the Anchor Institutions Task Force. What I want to make sure to mention is that we had 625 participants in this three-part series, and from all around the university, from multiple disciplines, and really demonstrated the need for health professionals who wanted to educate on social determinants of health for they themselves to also be educated. And you can see that we had partners from all over the university for this series. We also have academically based community service courses. In the School of Nursing, there are 70 across the university, 12 are in the School of Nursing. We're a relatively small school compared to some of the other schools in the university, but we are again committed to those courses that integrate research, teaching, and learning with community engagement. The students came to me when I took on the role as assistant dean in 2014 and expressed an interest in having more opportunities in community engagement. And therefore, we looked at our strategic plan and we really wanted to identify those community initiatives that would effectively integrate practice, teaching, and research. And the Community Champions Program was developed. The Community Champions Program is a student-run, faculty-mentored program that provides students with additional opportunity to engage in the community. We currently have over 50 students and 17 community sites. When we started, it was about 20 students and 5 sites. This program continues to grow. We are going into this year, and we haven't finished our enrollment, but it looks like we'll have probably over 60 students this year. We have more students that are interested than we have sites, and this is really a wonderful problem to have. This is a few slides of some of the programs where our students are engaged. This is the Dance for Health program. We've had over 800 community members engaged in our Dance for Health program. We focus on the social determinants of health, of access to care, and specifically around food insecurity and physical activity. It's an intergenerational program in 5 sites. Our students also work with women who are post-recovery and post-incarceration, and again, focusing largely on housing insecurity, food insecurity, and we have students who are in schools working with children on literacy and also working with undocumented immigrant population. We also wanted to make sure that our curriculum was adequate in terms of the courses that would address the concepts and competencies of global and community engagement. And we found it was necessary to develop a new course. So we developed a case study that's entitled Addressing the Social Determinants of Health, Community Engagement Immersion. And that course is a flipped classroom. So most of the coursework is in the community. The students are only in the classroom twice a semester, and the content is delivered, online discussions, discussion board posts, TED Talks, and again, very careful faculty mentorship of the students' work in the community. This course is highly evaluated, and when I talk a little bit later about outcomes, I'll show you some of the outcomes from this particular course. A key component of educating health professional students on social determinants of health is the organization. And is the infrastructure there, and is the university and then the school supportive of community engagement and social determinants of health? The Penn Compact 2020 has three major components: inclusion, innovation, and impact. The development of the role Assistant Dean for Community Engagement has allowed me and everyone who's in this position after me to really look at the school's tripartite mission and ensure that the school is committed to addressing and understand social indicators of health locally, nationally, and globally. So what are the challenges? Sharmila and David asked me to be sure to discuss those challenges, and the challenges are really easy to address with one slide. This is the major challenge. The vast majority of our students come to Penn Nursing to work in hospitals and actually to work in acute care. And the greatest challenge is really having nursing students and nursing faculty understand that addressing social determinants of health is key regardless of setting. So social determinants of health is not something that we talk to students about addressing in the community, in the school, in outpatient settings, but in the intensive care unit, in acute care settings, and in all settings that nurses practice, it is essential to have knowledge of the community and address social determinants of health. And I have personal experience with this. I am an acute care nurse practitioner. I'm a diabetes nurse practitioner in Children's Hospital of Philadelphia. We follow 2,700 children. We have excellent outcomes in well-resourced families and very poor outcomes and racial disparities and health disparities in our under-resourced families. We now are addressing social determinants of health in our children with diabetes through community health workers. And our early data show that community health workers addressing only social determinants of health, they do not do diabetes education or diabetes management, has resulted in an improvement in diabetes control and also an increase in addressing social determinants of health and also quality of life. So more to come with that, but again, I have lived experience of the importance of addressing social determinants of health, how inadequately we are able to care for under-resourced, vulnerable families without a social determinants of health lens. So our measures of success include the data from our course, our Social Determinants of Health course, that certainly demonstrate that students feel much more prepared to address social determinants of health and to understand the impact of social determinants of health once they are enrolled and take that course. And that also includes incorporating cultural sensitivity and addressing disparities, which are all a very important part of social determinants of health. We have published our data and we look at this as a success because we publish our data on our Community Champions program and also our specific programs. And this is, again, a study on Dance for Health and addressing social determinants of health in that intergenerational community. We present our data nationally, And when we present our data nationally, our nursing students are paired with high school students from the community who are engaged with us throughout all of our programs in the community. And together they are presenting nationally. It was very important to us that when we present data, when we receive awards, as you see, we've received a number of them, including a citation from the mayor and Philadelphia City Council, that these accolades and these opportunities will be available not just to Penn Nursing, but to the community as partners. And this has been an incredibly gratifying experience for us, and I think demonstrates our true commitment to partnership. We also now have the President's Engagement Prize, which is a prize that was developed by the president of the university to engage students the first year after graduation to really change the world and move the needle in terms of community engagement. 3 students or 3 groups of students are awarded every year. It's a $100,000 award for their project for the year. And since the project started, we have had at least 1 student winner each year. And again, I think this points to our organization and how the university is committed to improving lives in the community. This is the Penn Nursing Community Engagement Heat Map. And I do want to give you some background in that Philadelphia is the poorest, has the highest rate of poverty of any of the 10 largest cities in the United States. We have the darker areas here that you see where our faculty are mostly engaged is West Philadelphia, and that's where the university sits. But you can see that our faculty are engaged in community efforts and addressing social determinants of health throughout the city. When you think of nursing, you often think of nurses in communities. I'm sorry, nurses in hospitals rather than nurses in communities. But these are practice, education, research, and service activities that our faculty have throughout the city. It's also important for us to recognize, in terms of the depth of poverty, that the 1st congressional district that borders the university has the 2nd highest prevalence of child hunger, second only to the Bronx. So we are in the university and in our health systems very deeply immersed in areas of poverty that are negatively affected by social determinants of health. We also have the Alliance for Community Engagement, and this points to our interprofessional work: nursing, medicine, social work, dentistry, public health, veterinary medicine, and engineering, all focused on addressing social determinants of health and community engagement. The Penn Futures Project is a project that was developed by the deans of the School of Social Policy and Practice, School of Nursing, and Graduate School of Education. And this is a joint initiative to create innovative interdisciplinary projects to improve the health and quality of young lives, and also to transform graduate education, focused on addressing social determinants of health. And these are our current projects for Penn Futures, focused on a variety of areas in the school, in shelters, and also in the university. So I want to end with a quote that has been very important to me in my career. One of the authors is Ira Harkavy, who is one of the founders with David Morass of the Anchor Institution Task Force. And he said, they said, no serious health problem can be solved and understood without academics, clinicians, and the community working closely together to solve it. And the last quote that I'm going to share with you is particularly important when I think about Penn Nursing, and that we are neighbors, that we are a well-resourced university. with well-resourced health systems surrounding us in an area of high poverty. And this quote is by Dr. Joaquin Prince. He actually gave the lecture prior to Dr. Martin Luther King's I Have a Dream speech. And what he said was, neighbor is not a geographic term, it is a moral concept. It means our collective responsibility for the preservation of man's dignity and integrity. And if we all in our health professions think about what kind of neighbor we are, and that it's a moral concept, we can move forward together and make great strides in addressing social determinants of health. I thank you all for being part of this very important webinar.
Great. Thank you, Terry, for that very informative presentation. I'm now going to turn it over to our second presenter, Ms. Angela Mingo. She serves as the Director of Community Relations for Nationwide Children's Hospital in Columbus, Ohio. She is responsible for developing and managing strategic partnerships with external organizations, and she directs the community engagement efforts of the hospital, working closely with neighborhood and civic organizations. She has been instrumental in the implementation of the Healthy Neighborhoods, Healthy Families initiative, a five-pronged approach to neighborhood revitalization efforts on the city's south side, led by Nationwide Children's Hospital. She's also currently serving on the United Way of Central Ohio Home Impact Council. Angela earned bachelor's degrees in Portuguese and International Relations, as well as her master's degree in City and Regional Planning from The Ohio State University. And her honors include Columbus Business First Healthcare Heroes Award, Greater Columbus Community Helping Hands Community Relations Ambassador Award, and recognition in Who's Who in Black Columbus. So I'll now turn it over to Angela.
Wonderful. Thank you so much, Sharmila, and thank you to David and the Anchor Institutions Task Force for this opportunity to share the work that we're doing at Nationwide Children's Hospital and really share with everyone who's joining us today how we as a healthcare institution are adopting a health lens to focus on the social determinants of health. So today what I'd like to do is take you through a journey of what we are doing in our immediate neighborhood through an initiative called Healthy Neighborhoods, Healthy Families. And what I'd first like to start with is our strategic plan, which we've titled our Journey to Best Outcomes. And at Nationwide Children's, we are looking at not only our core strategies, but also goals that we've set forth to make sure that we can provide the best outcomes for children that we serve who live everywhere across the country. We currently service children from all 50 states within the United States, as well as 45 countries. We have children who are coming to see us. And today what I'm going to focus on is one of the 4 key accelerators to achieving that journey to best outcomes, which is our Wellness and Population Health Accelerator. One of the things that we focus on here at Nationwide Children's through the lens of population health is providing high quality clinical services, as well as connecting our patient families with clinical care that offers social support. So when we identify a need for our patient population, we are always trying to link them with the additional social supports that can help make them successful in their health outcomes journey. As well as we've heard today, the importance of addressing the social determinants of health. We know that clinical care accounts for about 20% of health outcomes. The other factors that affect the health of our pediatric patients are those social determinants of health that have been discussed so well today. So where a child lives, access to safe, fresh foods, safe housing, employment opportunities for parents, all of those items impact social determinants of health in the health outcomes for our patient population. Nationwide Children's, just a few quick facts about who we are. We are the second largest pediatric freestanding hospital in the United States. We see 1.5 million patient visits per year. And we are also home to one of the nation's oldest and largest accountable care organizations. which means that we are responsible for the health outcomes of more than 325,000 pediatric patients who are Medicaid patients here throughout the state of Ohio. The map that you see before you represents 34 of the 88 counties throughout the state of Ohio. Those 34 counties represent our Medicaid patient population. And so keeping this population healthy matters. We service this population on a capitation rate. So it really does make a difference if we can keep them healthy where they live and manage that health care cost. As we look at how do we create a lens of focusing on the social determinants of health of our patient population, we initiated a neighborhood initiative 10 years ago called Healthy Neighborhoods, Healthy Families. The map on the right represents this neighborhood initiative. It's identified by the 2 low to moderate income census tracts highlighted in orange immediately north of our main campus. Healthy Neighborhoods, Healthy Families is a place-based initiative, really going back to focusing on the zip codes that are most vulnerable within our immediate area. And one of the things that we know is that a child's zip code matters. Oftentimes, a zip code can be a greater definer of health outcomes than one's genetic code. And so we saw this as a critical opportunity to develop a place-based initiative that can really focus on the different aspects that are impacting the lives of the children that we serve right here in our campus footprint. Healthy Neighborhoods, Healthy Families is focused on 5 comprehensive prongs, which includes education and how can we as an anchor institution partner with our local schools to build strong relationships to improve the health outcomes of our children, as well as workforce development. How are we not only engaging our pediatric patients, but also the parents and guardians of our pediatric patients by providing workforce training and development opportunities? How are we working in the area of safe and accessible neighborhoods to make sure that children can grow up healthy and safe so they can go outside and play and do all those recreational activities that we know matter? And how are we providing greater access in the area of health and wellness, making sure that we can go out in the community and touch our patient population when they can't come into the walls of our hospital? Today, the focus of what I want to talk about through our Healthy Neighborhoods, Healthy Families initiative is what we are doing in the area of affordable housing. And one of the things that we've learned over the years is that affordable housing has really become an anchor to improving health. And so when we started the H&HF initiative, we also created the Healthy Homes program. Healthy Homes has been an opportunity for us to impact vacant, blighted properties in our area by focusing on, 1, improving home repair, providing home repair grants, and improving the properties of existing residents who live within our footprint of our investment zone. Also, purchasing vacant, boarded up, and abandoned properties so that we could renovate those properties and bring them back online for home ownership. And also improving vacant lots by working in partnership with our county land bank to acquire those lots and do infill construction. And this is all in an effort to, 1, sustain the neighborhood. Terry had mentioned that her nursing school is working in a low-income neighborhood. Oftentimes, we know that the history of anchor institutions is that we are place-based, centered in low to moderate income neighborhoods where there's a lot of need and oftentimes not the resources to accommodate those needs. So being able to focus in our footprint by improving the housing stock also improves the health outcomes for our children. The Healthy Homes program has already improved over 350 vacant and abandoned lots throughout our footprint here on the south side. This has been a public-private partnership utilized or benefited by the seed dollars of Nationwide Children's Hospital, which have leveraged public and private funds from entities to include the City of Columbus, United Way of Central Ohio, and strong partnerships with CDC partners, Community Development Corporation partners, specifically Community Development for All People, which is a CDC partner located here on the south side of Columbus that was already engaged in affordable housing activities before we aligned forces. And then through their CHODO status, their community development housing organization status, we were able to leverage public dollars to enable the work that we've been able to do in the neighborhood. Our focus, as you can see, is impacting the worst properties on the street first, renovating those properties, and then creating home ownership opportunities for our patient population, our employees, and residents on the South Side who wanted to stay on the South Side but were looking for affordable housing opportunities. And I want to stress affordable because these homes are all below market rate. So we are making sure that we're keeping families in their homes, and we're working with families who also qualify as Medicaid patient families who have income limitations on what they can purchase in the neighborhood. This project has resulted in more than $30 million of total investment in affordable housing to date. And you can see here how we've impacted the vacancy rates in our neighborhood. We know that health is housing. We know that children need to be in safe, vibrant communities. And having vacant and boarded up properties really does matter. It does impact health outcomes. And over the years, we've been able to reduce the vacancy rates by more than 50% within our immediate investment area. As we looked at affordable housing, we started this initiative by focusing on home ownership, really as an effort to stabilize the neighborhood. We were coming through the recession at the time we started the Healthy Homes program, so we had a high volume of vacant blighted properties. So home ownership really was our first intro into neighborhood stabilization, as well as impact of health and wellness of the community overall, not just our patient population. But as we started this journey of housing, we quickly learned that in Central Ohio, more than 54,000 families are paying more than 50% of their household income towards rent. So that changed the narrative of what we were doing in the affordable housing arena, and we started to incorporate affordable rental into our portfolio. So thanks to a partnership through JP Morgan Chase and the Franklin County Land Bank, we were able to acquire a $1.5 million grant through JP Morgan Chase, as well as the necessary vacant lots and blighted lots that were acquired by the land bank to improve 75 rental properties. And so these 75 rental properties were really our entree into affordable housing from the rental standpoint. And rental properties that we are offering to families are for families who are earning or meeting that 80% of area median household income. That translates into approximately $62,000 a year for a family of four. So really capturing what we've learned now, our patient population that wasn't ready for home ownership but still had a great need for affordable housing are now becoming our tenants within our rental portfolio. The 75 units that we started thanks to the partnership with JP Morgan Chase started to begin to shift a pipeline of needs that we identified in terms of affordable rental. We realized very quickly that we were not able to produce enough units to address the demand here within the housing demands of the South Side. So thanks to an additional partnership with Ohio Capital Corporation for Housing, an affordable housing syndicator here in Columbus, Ohio, we were able to expand our investment area. And so the map that you see there on the left is our original footprint of our housing investment, with one additional census tract there immediately south of the two orange census tracts, which represents the existing improvements that our CDC partner was making in the neighborhood. That's now been expanded to a total of 8 census tracts near Nationwide Children's Hospital, where we are not only providing home ownership opportunities, but also affordable rental to families, again, at that 80% of area median income, and then focusing on families who are under 120% of area median income for home ownership opportunities. That 120% of AMI translates into about $93,000 a year of household earnings for a family of 4. And to create the enabler in terms of funding to enable this work, the partnership with Ohio Capital Corporation for Housing resulted in an innovative loan fund known as the Southside Renaissance Fund. This capital stack that you see before you represents that fund of $15 million, which consists of a blended interest rate of 3%, thanks to partnerships of more than 8 financial institutions here in Central Ohio who are part of that fund. The benefit to the financial institution institutions is that they are receiving their CRA credits for investing in this fund. The outcome for us is that we are touching the lives of up to 170, and we are touching up to 170 rental units that we can now develop, which is expanding housing opportunities for many families who are in great need here in Central Ohio. The fund helps to support the development cost of 75%, the development cost of each unit that we are bringing back online here in the neighborhood. The additional 25% of development costs is offset through grant funds that have been acquired through partnerships with United Way of Central Ohio, as well as the City of Columbus, which has been one of our greatest investment partners to date. The beauty of this fund, and what was really the interest to the financial institutions who made the investment to support this fund, is that Nationwide Children's Hospital serves as the loan loss guarantor on this fund up to 10%. So we are covering $1.5 million of loan loss reserve for this affordable housing fund. Wanted to just give you a sense of what we're doing that's creative in the area of affordable housing as we're trying to improve health outcomes for the entire community in addition to our patient population. The information that I was sharing through the Healthy Homes program represents scattered site development here on the south side of Columbus. The Residences at Career Gateway was a very innovative project that Nationwide Children's Hospital found itself engaged in. This is a low-income housing tax credit project, which resulted in 58 affordable housing units for families that we could not touch through our scattered site development because our minimum household income was at 80% of area median income. What's unique about the Residence at Career Gateway is that we can now touch families who are earning 60% or below of area median income. So really looking at some of our most vulnerable families who need affordable housing on the south side, who also represent our patient population. 60% of area median income translates to approximately $42,000 a year for a household with a total of 4 family members within that household. So really touching, again, those most vulnerable families that we've now been able to provide housing as well as workforce development training right here on site at the Residence at Career Gateway. So we now have, in addition to affordable housing, which consists of 2-bedroom townhomes and 2-bedroom flats, we now have workforce training on site that is facilitated by our human resource development team, who is now recruiting employees who serve as volunteers to provide soft skills training to families or individuals who are now living at the Residence at Career Gateway, as well as any resident who is a member of the Southside community or lives within the 3 focus zip codes where we are working to make an impact. And as we talk about some of the lessons learned as we've been through this journey of healthy neighborhoods, healthy families, first I want to start with our goals. Part of our goal is not only to look at population health and improving the health of our pediatric patients, but also the health of the entire community. We know that within our footprint in the low to moderate income census tracts here on the south side, that we have a number of families who have struggled over the years. This was a disinvested neighborhood for quite some time, and so we know that disinvestment, to turn that tide, it's going to take at least a decade to see some of the health outcomes that we're hoping to achieve. But what we're already seeing in terms of health outcomes is a decrease in the asthma emergency visits here at Nationwide Children's Hospital, a decrease in infant mortality rates here of the patients that the families that we're servicing here at Nationwide Children's, and an increase in kindergarten readiness through our education prong of the Healthy Neighborhoods, Healthy Families initiative. We've actually gone out into the community and focused on education, pre-K literacy education for children who are not yet in kindergarten, and preparing those kids for kindergarten has been very successful through the education prong. And so kindergarten readiness is improving within our neighborhood, and we believe that that's going to improve the graduation rates of the students here on the south side. In terms of some of the challenges, as we've focused on the affordable housing prong of Healthy Neighborhoods, Healthy Families, one of the things that we've learned is that acquisition timing truly does matter. When we started this work, we were looking at comps that were in a neighborhood neighborhood where no one was making investment. The private market had not yet come into our neighborhood, so acquiring vacant blighted properties was easily facilitated for us. Fast forward 10 years into 2019, the private market has now stepped into this area, into this neighborhood, and so we are competing in terms of acquisition, which means that we're competing and working very hard to keep housing affordable. The private market has now created a mixed income community here in the neighborhood, which is something that the mayor of the city of Columbus has been a proponent of. However, he's also a proponent of affordable housing. And so we are trying to stabilize the access to affordable housing here on the South Side. And in stabilizing that access to affordable housing, we can keep our most vulnerable families here in the community, and we can help address their healthcare needs. So we hope to see that over the next 10 years, as we continue to track and measure the health outcomes, we believe that sustaining affordable housing is going to help us have our greatest health outcomes here on the South Side. So I want to thank everyone for their time and attention, and I look forward to the questions that you have for us.
Great. Thank you so much, Angela. And that was a very comprehensive presentation. And so let's open it up now for questions and answers. And you can submit your questions via the chat box or the question box, depending on how that shows up on your screen. While waiting for that, I guess I will start with a question for Terry. So Terry, are health professional faculty prepared to teach social determinants of health, and what are the challenges in finding, or are there challenges in finding faculty with expertise in social determinants and experience in community engagement?
Yeah, so I think that's an important question, and it is also an important challenge. So we have there are faculty in nursing that are very prepared to address social determinants of health. There are a lot of faculty in nursing that also have degrees in public health. And of course, public health is anchored in social determinants of health and addressing community social issues. There are also many faculty who have a background in acute care, where social determinants of health have not been generally a focus of acute care. And those faculty are very needed in a school of nursing, but what we're working on now is how can they be combined? So they're not mutually exclusive. It's not necessary to have faculty focused on social determinants of health and population health, and then another group of faculty that are focused on physiology and acute care, but really to educate faculty and bring faculty along. And that's really what we've been focused on, is educating not just those faculty who are immersed in the community and have a passion for community engagement, but also those who are new to this area in terms of a way to really think about their practice and structure their education. So it is certainly something that nursing schools across the country are working with together in terms of those challenges.
Great, thank you. I'm looking to see if we have any questions here. I don't see any yet. Angela, I have a question for you. So what motivated Nationwide Children's to establish the Healthy Neighborhoods, Healthy Families initiative?
You know, I think there were a couple of motivators for us. One, being an anchor institution, particularly here on the South Side, we saw this as an opportunity to impact health in the traditional sense, having a very large pediatric patient population here on the South Side, which also consists of a large Medicaid patient population. We saw this as opportunity to do something that was place-based and really concentrate our efforts in improving health through the 5 prongs of healthy neighborhoods, healthy families. We also saw it as an opportunity to collaborate with the City of Columbus and our CDC partners, who were already making great strides to improve the overall health of the neighborhood. This is a neighborhood that, as I mentioned, had seen high level of disinvestment over the years. Many of the businesses and factories that were anchors here in this community have since gone away. Many residents have moved out, and what has remained has been a low-income population that has really been looking for opportunity for leaders and organizations that were making great strides in this space, but they really did need support. And being the anchor institution here on the South Side, we saw this as an opportunity to collaborate not only with the City of Columbus, but with the community stakeholders here for overall socioeconomic improvement. And I also think that, for us, there's a great opportunity to create a pipeline of employees for the hospital. Anchor institutions, we see high levels of turnover in our entry-level positions. This afforded us, through the residents at Career Gateway, an opportunity to create an employee pipeline, as well as provide opportunities for career pathways, so that as residents of the neighborhood are being employed here by Nationwide Children's, they have the opportunity to participate in a career pathway so that they are advancing in their careers, starting out maybe in an entry-level position, but certainly having opportunities for increased education and advancement within the organization. And so as we think about the socioeconomics of what improves health, it's traditional healthcare, but it's also access to employment opportunities and an improved quality of life.
Great, thank you. We do have a question here. I believe it's targeted to you, Angela. Can you comment on the role of the Board of Trustees at your institution?
I'm sorry, can you repeat the question?
Sure. The question was, can you comment on the role of the Board of Trustees at your institution?
So I can comment on the Board of Trustees at the University of Pennsylvania School of Nursing. And it's interesting that you're saying that, because we have a Board of Trustees meeting coming up, and the topic for that meeting is community engagement. So the Board of Trustees is very committed to community engagement and really is very committed to connecting us with sources of support related to community engagement. And of course, addressing social determinants of health.
Thank you. Angela, did you want to?
Sure, Sharmila, thank you. One of the things I'll share, I just presented to our Board of Trustees on the work of Healthy Neighborhoods, Healthy Families, and oftentimes as we have opportunity to speak to our peers in this space, the eds and meds who define anchor institution, I'll receive the question from other anchors, which is, how did you motivate your hospital leadership to identify this space as a priority? And what I always respond with is that we were very fortunate here as staff of Nationwide Children's leading this effort, that this was a top-down approach to improving health outcomes in our community. Our board of trustees have been one of our greatest champions in this space of impacting social determinants of health. And so oftentimes they are the ones who are leading us in looking at how can we go deeper in our neighborhood investments, how can we be innovative in the partnerships that we've established to impact health outcomes, and how do we bring fellow employees alongside of us. And so as Terry's been sharing in her work at the nursing school, bringing residents into the community to train, that is one of the components of what we've been able to do thanks to our board leadership. We now have residents going out and learning more about the work of Healthy Neighborhoods, Healthy Families, and learning how they can be a part of that work during their off time, how they can mentor students through the school district, how they can help work with our CDC partner to advance the work of Healthy Neighborhoods, Healthy Families. Our board is now teeing up a neighborhood tour where they can actually go out and see the work in person, so they can see it, feel it, and learn from some of the recipients of our Healthy Homes program, some of the renters who've been the beneficiaries of the investments that they support. So I would just say that the role of the board has been one of a champion, which has really helped to enable and expand the work that we do.
Great, thank you so much. So I think I don't see any other questions coming in, and it looks like we're almost we're at 1:30. So I just wanted to take this opportunity again to thank you both, Angela and Terry, for those just fabulous presentations and really giving us some food for thought. And I encourage all of you, if you have a chance, to take a look at the paper, the white paper, and to stay tuned for more of these webinars as we showcase other members of the subgroup as well. So thank you again for joining. And if you have questions or comments, you can always email our presenters. And thanks for taking the time today to be with us. Thank you all.